diverticular disease, diverticula, diverticulosis, diverticulitis. This is a topic that my patients usually ask me to explain multiple times. And I get it. It can be very confusing when there's so many medical terms that all kind of sound the same. In this video, I'm going to explain diverticular disease very clearly once and for all. Welcome back, everyone. Today we're talking about diverticular disease. If this is your first time here, I'm Dr. Kenny. It's great to meet you. I know your life can get pretty busy, and so my goal is to talk about medicine in a way that's simple and straight to the point. Let's tackle the hardest part first. Let's talk about the key terms and definitions of diverticular disease. What are diverticula? Basically, they're little pouches, outpouchings. I'm going to use this little toy to explain diverticular disease visually. This is a llama. It's one of those poo-poo animal toys. The reason he's called a poo-poo toy is because if you squeeze him, you get this little poo-poo coming out. If you put a little pressure on this llama, aka squeezing, then you'll get this little outpouching. Hope you guys can see that pretty well, but basically the pressure is causing this outpouching. So now imagine all these little outpouchings all along your gut, all along your digestive tract. Your esophagus, all the way down to the end of your gut, which is your colon. Diverticula are very common in your colon. The colon is your large intestine. It's at the very end of your digestive tract. The reason that diverticula are so common in the colon is because you can build up a lot of pressure in the colon since it is at the end of your gut. These diverticula, or these pouches, can occur anywhere along your digestive tract. Remember, pressure will cause these outpouchings. So over time, you can get diverticula in your colon if you build up a lot of pressure in your colon. If you've had constipation for many years of having to strain when you go to the bathroom, many years of eating food that's hard to digest, then I wouldn't be surprised if you had a few diverticula in your colon. So one of these outpouchings is called a diverticulum. Plural or many diverticulum are called diverticula. The condition of having diverticula, if you have many diverticula in your body, that's called diverticulosis. And finally, if any of your diverticula get inflamed or infected, then that's called diverticulitis. How do I know if I have diverticula? Most people who have diverticula won't know it. And if you have diverticula, you may not know unless you get a colonoscopy to take a look. A colonoscopy is when doctors use a camera to look at the inside of your colon. We can talk about that in another video. Having diverticula is common, especially with the American diet. Diverticula usually doesn't cause symptoms. Many people with diverticulosis usually go their entire lives without feeling anything. But there are many complications that can happen with diverticulosis, and we'll talk about those next. Diverticula can get infected and inflamed. If you have diverticulosis, one of the things that can happen to your diverticula is that they can get infected. If you think about it, they're pouches in your colon, and your colon is filled with feces and bacteria. So if one of your diverticula gets clogged with feces or bacteria, then yeah, it can get infected and you can feel a lot of pain. Then that's called diverticulitis. The treatment for diverticulitis, since it's an infection, is antibiotics. You'll get really bad belly pain, usually in the area where the infected diverticulum is located. And if there's clogging, you get diarrhea, you can get constipation, you can get either, and you can get both. Diverticula can bleed. The second thing that can happen with diverticulosis is that your diverticula can bleed. You'll notice blood in the toilet. You may need to see a gastroenterologist or a stomach doctor to help take care of the bleeding. Diverticula can perforate. If you have diverticulosis and there's so much pressure and so much inflammation, they can actually pop. They can actually burst open. In medical terms, we call this a perforation. This can get really bad. If a diverticulum that is clogged with feces and bacteria bursts open, it can spill all of its contents into your belly, and this can become a medical emergency. It's not common, but it can happen. If your perforation is bad enough, you may even need surgery. What is the treatment for diverticular disease? If you have plain old diverticulosis, no infection, no bleeding, no perforation, then you don't really need any treatment. What we recommend is to increase fiber in your diet so that you can move your bowels easier and so that you don't make your diverticulosis worse. Fiber includes fruits and vegetables, beans, oats, nuts. If you have diverticulitis, which is an infection, then you'll need antibiotics. If you have a mild case of diverticulitis, like maybe you just have some abdominal pain, then you could potentially treat it at home with antibiotic pills and being on a short-term diet with just clear liquids. Water, broth, juice. If you have a more severe case of diverticulitis, this means fevers, chills, severe abdominal pain, inability to swallow pills, inability to eat or drink, then you need to stay in the hospital with us to get antibiotics through an IV. This means that the antibiotics are delivered straight into your bloodstream. You will temporarily need to not eat or drink anything to let your bowels have time to rest because they are so inflamed and so angry. If your diverticulitis has perforated and spilled all of its contents into your belly, then that's the most severe thing that can happen. Sometimes the perforation will be well contained, meaning it'll just form a little pocket of pus. If that's the case, then a surgeon can go in there with a little needle and just suck out the pus. If the perforation is a real big one and stuff just spills everywhere, then that's the worst case scenario. Your belly will be full of feces and bacteria, and that's a medical emergency. You can get sick really quickly. It depends on a case-by-case basis, but some people with very severe diverticular disease may need parts of their colon removed, and some people may temporarily need a colostomy bag. What is the prognosis of diverticular disease? After you finish taking antibiotics, and after a few weeks have passed, allowing your bowels time to rest and calm down and heal, then we recommend that you get a colonoscopy. With a colonoscopy, a doctor can take a look inside your colon to see what's going on, whether there are diverticula, whether there are polyps or masses or other things. I hope I didn't scare you too much with all this information, talking about bleeding and perforation and infection, but if you take it on numbers and statistics alone, most people with diverticulosis never get diverticulitis. Only about 15 to 25% of people with diverticulosis will actually develop diverticulitis. If you're watching this, what I would do is take a look at your diet and see if increasing fiber is something you should do. I would discuss this with your doctor or a nutrition expert. Okay, so that was a lot of information. Let's try to summarize what we talked about today. Diverticulum are outpouchings along your gut. Diverticula is plural, having many diverticulum. Diverticulosis is the medical condition of having a lot of diverticula. Diverticulitis is the inflammation of those diverticula. Diverticulosis doesn't need treatment. Just eat more fiber. Diverticulitis needs antibiotics. If it's severe diverticulitis, like a perforation or something, then you may need surgery. Your digestive tract works really hard and it works under a lot of pressure. If you eat well and you eat healthy, then you can help relieve some of that pressure. You can help relieve some of that burden. Okay, in the comments below, let me know what is your favorite way of getting fiber in your diet. Please share this with your friends and family. Hit the subscribe button if you want to support us and see more videos like this. Give it a thumbs up if you thought it was helpful. Thanks for watching. I'll see you next time.